Hey guys, it is Thursday. It is September. It is the 15th. And man, is time rolling on. I was going to do this video last Friday. And I had everything kind of set up and ready to go. And then all of a sudden I got the message that at CARE South Carolina, we had gotten and was in stock and administering the bivalent vaccine, the new bivalent COVID vaccine. So I literally dropped everything and went over to Hartsville to get my vaccine. There's been a little bit of delay on this video, but it's a good thing, frankly, because we did a lot and a lot got done and lots changed and happening this week. So it was kind of like the higher powers knew that don't get that video out Friday. There might be some big developments in the forthcoming week. And yes, there was some big developments. The first off, the Performance Improvement Committee met on Tuesday, our regular meeting, followed by on Tuesday morning. Did I just say Monday for PI meeting? I hope so. Anyway, followed by Tuesday morning, the COVID task force met. And one of the things that I wanted to put on the agenda was based on some discussions that I'd actually had Friday afternoon and kind of over the weekend around how other organizations were now addressing COVID issues and safety precautions and so forth. So these ideas and these thoughts were presented at PI, and they were essentially approved at PI. And we discussed them again in the COVID task force early Tuesday morning this week, and kind of fine-tuned some things and tickled a few things and made a few developments and so forth. And here it is. So we are changing the CARE South Carolina COVID masking guidelines, but only for non-healthcare settings. I'm going to repeat that. We are changing the COVID masking guidelines at CARE South, but only for non-healthcare settings. Now that's that's settings, buildings, locations in which healthcare services are not provided to patients. That is a non-healthcare setting. We're actually following the CDC guidelines on this because CDC makes a distinguishing difference between what happens in a community setting versus what happens in a healthcare setting. And y'all have known this for a long time. But what we have come to the decision around is that CARE South Carolina is not homogeneous. We're not all the same. We have both. We have healthcare settings and we have non-healthcare settings, which are essentially community settings. So, you confused yet? When I send this email out, I will have this attached in a little bit more detailed Word document that maybe can help understanding, but I make no bones about it. This is a complicated issue. It's not easy to understand. Those of us in performance improvement and on the COVID task force have tried to make it as simple as possible, but it's still a complicated issue. Now, in healthcare settings, and that's all of our locations where we provide care to patients, there's nothing changed. The guidelines for those locations have to follow the CDC guidelines and which are part of the CDC map called transmission rates. That's a whole separate map than the map for community levels. And right now, every single one of our counties is red which that means there is very high transmission levels. And according to the CDC guidelines for healthcare facilities, that they require, not recommend, but require that personnel in those settings wear a mask. So that's no change. However, CDC has said for a long time that in community settings there are going to be different guidelines. We just never made a difference for that at CareSouth. We didn't distinguish between what was a healthcare setting and what was a non-healthcare setting. But frankly, things are beginning to change. People are beginning to have to go out to meetings in different locations that are community settings, not healthcare settings. They're going to conferences, workshops, and different events, all not in healthcare settings. Those are community settings. So that's what we've done with this change. We've made a distinguishing difference between what is a healthcare setting at CareSouth and what is a non-healthcare setting or a community setting. And basically, we don't have a lot of those. We have offices like, well, corporate office is one, special programs is one, and a few of our other offices like the call center, the HR office. These are all locations that are not providing health care to patients. So these are what we have determined are able to be called community settings. Also, when an individual, a CareSouth employee, goes to one of these events or what have you in another location, as long as it's not a location in which there is health care being provided. And that frankly, I can't even remember a time when that actually happened. So what happens in these new designations, community settings? Well, we have to follow the CDC recommendations, and that too is not a one-size-fits-all. John Douglas produces a weekly COVID data briefing that we send out to each of you, and he tells you that which counties have a community level of high, medium, or low. Right now, Lee County is our only county with low. Darlington County and Dillon County have a medium rating, but Chesterfield and Marlborough have a high rating. When I attach my document to the email that I'm going to send out, I'll give y'all some linkages so that you can take a look at that map. That map changes weekly. The CDC updates it, and according to their own guidelines, they update it every Thursday, but by 8 p.m. So really and truly, the best time to look at that map is Friday, because that map is going to be the guideline that we all follow depending on where we are in a community setting doing CareSouth Carolina business, like going to a meeting or working in an office that is a community setting. You confused yet? I'm hoping that the document that I attach helps you understand this, but let me just give you an example on this. So let's just say that we actually used to have an admin office, but let's just say we have an administrative office in Bishopville. We actually don't. We have a medical office. We have a dental office. So we actually don't. But let's just say that we did. Lee County, right now, community level, according to the CDC, is low. What does the CDC recommend? Because remember, it is not just around masking that the CDC makes its recommendations. Because here is what they say. If you're in a county like Lee with low, they recommend you stay up to date on your COVID-19 vaccines. I'm going to come back to that later. You get tested if you have symptoms. If you have symptoms, you wear a mask. If you've gotten a positive test, duh, you wear a mask. Or if you've had an exposure to someone that has COVID, you wear a mask. We've known that for a long time. You wear a mask if you're on public transportation. Otherwise, you may choose to wear a mask, depending on your individual risk. Like those who are immunocompromised, they probably want to continue to wear a mask because you're wearing that mask to protect yourself and others. Now remember I said I'll circle back to what the CDC means by staying up to date on COVID vaccines. That actually means that you've received all of the vaccines, including the boosters, for which you're eligible. That is a CDC requirement. That's not a CARE South Carolina requirement yet, and I'm not really sure it ever will be. We'll see. But that is something that you individually are going to have to determine. We're not going to be the vaccine police. If there was an administrative site in Bishopville and you were working in that, or you went to a meeting in Lee County and you chose not to wear a mask, it is your responsibility to assure that all of these requirements are met, including the ones that say staying up to date with vaccination. So it is a change. It's not necessarily a simple change. It's not necessarily all that easy to understand. We've tried to make it as simple as we can, and I will attach this information to the email. But I'm hoping that as we begin to move into some of the next phases, that we're learning how to deal with COVID. We're learning how to do it safely. We're learning how to do it effectively. And we're learning how to do it with the least risk to both you and those who you have interaction with, your family, your grandmothers, your grandparents, your older friends, and so forth, because what you do as an individual impacts them. So, when we read this guideline, we decided to kind of take a little deep dive and see where we stood as an organization. Every one of us, you can't work at CARE South unless you've had a medical exemption on getting the COVID vaccine. So that literally means all of us, for the most part, have had at least the initial vaccination. Might have been one Johnson & Johnson, or it might have been two of Pfizer or Moderna. But, there was one booster that was out last fall. And it's still available, honestly. It came out last fall. But only 42.3% of us have had that booster. Less than half have received the first booster. Remember, I told you there are 3 boosters now. And the second booster, that booster came out in the spring of this year. Only 9.02% of us have had it. That's the second booster. Now the third booster is brand new. We only had it last Friday, or Thursday, Friday last week. And even though only 1.16% of us at CARE South have had it, I'm one of them. There are several CARE South Carolina staff that have gone after that third booster. The bottom line is get boosted, people. It's simple. I'm going to provide you some information. People say, well, I've had the booster and I still got COVID. We've reached a point where we've learned a lot more about COVID and how these vaccines and what role they really play. And the most significant role they play is they prevent death and hospitalization, especially for people who have comorbidities or at higher risk, or have some immunological compromised condition. What the data shows, and I'm going to give y'all a copy of these, that the majority of deaths are still amongst those who are either completely unvaccinated or who haven't received boosters. Yeah, the elderly are definitely at risk. But I think it's kind of interesting because for those folks that are in the age range of 70 to 79, old folks, they only have a 1 in 568 chances of dying with COVID, which is the exact same thing, same risk that those folks that are, 50 to 59 and have only had the 2 doses, or less than the 2 doses. So, it's pretty clear that even though the older we get, the more risky it is, it's also pretty clear that the less vaccination that we've had. I know I also hear people saying, well, I've actually had COVID, therefore I've got a lot of antibodies already. Well, those antibodies don't last forever, and, frankly, who wouldn't want more antibodies that you can get even after you've had COVID? You might want to wait several months after you've had COVID to pump those antibodies back up with a vaccine, but you still get some boost as early as 2 to 3 months after you've had COVID from getting a booster. So, I hope that this doesn't confuse the daylights out of everybody. It probably will, but things are developing, they are evolving, and we have to see if we can keep up with it and recognize that it's going to be a new world. However, I want to mention another part of what's going on in the world around infectious disease, and that's monkeypox. We spent quite a bit of time at the staff meeting with a lot of folks, either in the departmental breakouts or in some of the workshops, talking about monkeypox. I am mystified, baffled even, by this uproar that seems to have swept the United States and, frankly, South Carolina about monkeypox. There are 400 people a day that are dying from COVID. A day. Let me repeat that. 400 people a day are dying from COVID. In the past 7 days, since the 6th of September to the 12th of September, 2,299 people died from COVID. In August alone, 15,284 people have died from COVID. And how many monkeypox deaths have there been? One. I'm baffled at why we have this huge furor, this huge drama going on across the United States and even in South Carolina on monkeypox. We've had 2 of our own die from COVID. I want everybody to take a deep breath. If you haven't fully gotten information around monkeypox, we have a lot to share. You received education and information at the staff meeting. You can go on to Facebook and look for Marek's blog that was Friday a couple of weeks ago. And one of the CDC experts around monkeypox was there to answer questions and provide information. This is not a disease anywhere near like COVID. COVID is extremely transmissible. In order to catch monkeypox, it takes long, sustained contact with the individual and their sores or their secretions that are caused from monkeypox. Long, sustained. And that's why it's most common as almost like a sexually transmitted disease with men who have sex with men. You'll see that in all of the information and data. We need to get a grip. We need to be responsible healthcare providers, knowledgeable, and understanding infectious disease risk, whether it's COVID, monkeypox, flu, or whatever new thing comes waltzing down and gets us all in a war. But folks, make sure you're educated and that you understand, because you are healthcare professionals. We expect nothing less from you. Okay, not related to this stuff, like monkeypox or COVID. Just a little bit of news. You know, we have developed an employee newsletter. I think we're changing the name of it. You've gotten the first issue, and it was called the CareSouth Chronicle, I think. Now, I think we're going to call it the Care South Carolina Pulse. Jury's still out on that. But why are you getting an employee newsletter? Well, I think that one of the most important things we can do for you from the point of management or supervisors is keep you informed. We've got locations scattered all across these 5 counties, and it's really hard for us to make sure that you have up-to-date news and information that's going on. And that's the biggest thing that we hear frequently when we hear talking about, we don't know what's going on. I get it. I understand. And that's why we're putting this newsletter out on a quarterly basis, is to provide information about what is going on in CareSouth, in our various departments and divisions that you need to know about. So just wanted to bring you up to date on that. You know, we felt that was important because we hadn't been able to have staff meetings. Well, now I think we're going to be able to get back into the swing of staff meetings. We had a good couple of days of staff meetings. We learned some things, and the staff meeting, there will be a December staff meeting, Lord willing, and the creek don't rise. And it may probably will be a slightly different format. We're doing some debriefing on that and trying to figure out how we want to structure December. But we recognize that even on the staff meetings, we are really, frankly, unable to keep you up to date and informed on everything that's going on. And that's why this newsletter will be really important. Also important is something that's going to be happening next week, and that is strategic planning. The board and management of CareSouth are doing an annual strategic, well, really isn't annual anymore because we hadn't done it since COVID, but a strategic planning, it's a retreat. We're going to take some time to see where we are, see where we've been, recover from the COVID pandemics and the reactions that we had to be, and become proactive in strategy and where we want to be in the future at CareSouth. We've done an awful lot of preparation for this, an exhaustive data analysis, looking at data every which way, including demographics, quality performance, a lot of multiple different perspectives. We've also heard from the community. Joe did focus groups, and we've heard from you. Thank you for doing those surveys. All of this is going to go in the pot, get stirred up for the board and all of the management to dwell on, think on, and think about what are going to be our strategic priorities over the next 3 years coming out of this COVID pandemic. So it's going to be fun to see where we're going in the future at CareSouth. There's a lot of innovation, a lot of potential. We've learned a lot from this pandemic. Yeah, we have. But now we need to take a deep breath and see where we're going. And we will. So, enough of all of this. I know this is a very long video. Many of you may decide just to read the email. That's fine. Stay safe. Be careful. Folks, there is still a serious virus out there. I'm going to repeat, 400 people across the United States are continuing to die every day. You've seen it at CareSouth. Let's don't let it be another one of us, or your friends, or your family, or your grandparents. Stay safe.